We're back with our patient/model Amanda, and she's going to help us demonstrate today a standard chiropractic spinal adjustment. Now, traditionally, that includes adjusting the three areas of the spine: the cervical or neck area, the thoracic or mid-back, which is essentially the rib cage area, and then we have the lower back or pelvis area. Now, when we're adjusting these different areas, the idea is to realign and restore natural, normal range of motion. We all, in every one of our joints, have an optimal and normal range of motion that, through muscle activity and misalignment, can become restricted. My goal through these adjustments is to restore the natural range of motion and to get rid of those joint restrictions, which can sometimes just limit the way that you can turn, or they can actually create pain in the specific joints themselves. Now, starting in the neck area, typically this is the area that patients seem most hesitant towards. The idea is that cervical manipulation is actually damaging or risky is actually a misconception. In fact, all the research that has been done scientifically has shown negative impact of this is usually about one case in anywhere from 1 million to 5 million treatments. So for the majority of chiropractors, a chiropractor throughout their entire career would never witness an actual negative impact to a chiropractic adjustment in their office. When we adjust the neck, we're looking to primarily restore normal rotation, since that's the most extensive form of movement in our neck. What I do is, using my hands, we identify which areas are restricted through feel or palpation, and we adjust those areas as so. Then when we go from the neck, we move into the mid-back. Now, the mid-back is very important because it's our foundation for posture. In fact, poor posture usually starts in the mid-back with slouching. As we slouch, it tends to stretch out a lot of the back muscles, putting them under a lot of pressure, and it restricts our normal natural movement to bend backwards. In addition to slouching, you can also see that my neck then has to extend backwards to keep my eyes level, which, if I were in a proper posture, would be the equivalent of about looking up to someone that's about 6.5 to 7 feet tall, which can place a lot of pressure on the muscles in behind here. When we adjust the joints in the mid-back, very simple procedure. We're just going to bend the knees here, 1 and 2. Amanda's going to give herself a little hug. We reach around underneath, big breath in, breathe all the way out. And again a second time, and all the way out. Good. And now we've helped to restore some of the natural extension that may have been lost just through some postural slouching. Shifting from the mid-back into the lower back, the pelvis is kind of our foundation that connects the lower body to the rest of our body. Whether we're sitting or we're walking around, this area is very important to make sure that everything going up through the spine is equal. If one area were to become restricted, it can then transfer improper forces up from the legs, or when you're sitting, from just the weight of your body up or down the spine, causing restriction or overloading the muscles and starting a pain process. So with that, we'll get Amanda to turn over and face me. Bend one leg and rotate her body as so. And the lower back and pelvis in this area will be adjusting, having her roll over nice and relaxed. As such, and onto your other side. Always important that we adjust both sides for proper symmetry of movement. And rotating her over again. Good. And on your back. So with that, we've gone through a complete spinal adjustive procedure that incorporates the cervical or neck, mid-back, and lower back. Next video, we're going to be going into adjustments of the extremities and how they can help and impact your recovery as well.